Yeah, so one of the challenges that we have in lung cancer is that the standard course of radiation treatment, the standard dose that we use for the majority of patients, is not adequate to sterilize the disease. So why don't we just give more dose? Well, you can if you're dealing with a tumor that's very small and located nice and far away from all critical structures. Then you can dial up the dose because you don't have to worry about collateral damage. But if you have a tumor that's sitting close to the heart, as many lung tumors are, and most lung tumors are, or near the spinal cord, or within the lung, then you can't just keep dialing up the dose. And we've tried that. We've tried with modern radiation techniques to dial up the dose. And what we found is there's a tipping point where you do more harm than good by dialing up the dose. And we just saw a very big trial demonstrate that for us. When patients had a higher dose of radiation, patients with locally advanced lung cancer were given a higher dose of radiation with modern X-ray based therapy, they actually had a poorer survival than the patients who got the standard dose of radiation, even with modern techniques. So protons may be a way to push that tipping point further back, allow us to get more dose in without crossing that tipping point where we're doing more harm than good. And so that's why, although intensification of therapy is a worthwhile pursuit, you have to figure out up front which weapon you want to use to intensify your therapy with. And X-ray based treatment intensification doesn't seem to benefit the majority of our patients. So it's possible that proton-based treatment intensification can succeed where X-rays failed to do so. And we're examining this in a very large phase 3 randomized trial that's ongoing right now, and our center is one of the many centers that's participating in this study.